Hi folks, thanks so much for joining us, and joining me today is Dr. Wendy Wells from Wells Source Naturopathic Medical Center. Doctor, thank you so much for being here.
Thank you for having me.
We appreciate it. The topic today is something that most people deal with at one time or another, stress, some more than others.
Right.
Before we talk about a specific treatment that you recommend, what are some of the triggers, the common triggers for stress?
Okay, common triggers for stress would be things that are happening in one's life. So it could be overwhelming situations, grief in the family, some kind of a promotion at work, or maybe being laid off, so work changes, marital status changes, those could be big stressors also.
And a lot of times people don't feel the stress,
Right,
even though they are indeed stressed out. Is that correct?
Exactly. There are certain people who will experience small things as large stresses, and those would affect them more.
I see.
You know, other people will barely experience stress, even though they're going through big change. So it does vary person to person how much accumulated stress they actually experience.
And then on the other side of things, it could be actually a chemical imbalance in some folks. Is that correct?
Right. Many patients come for a variety of different conditions to my office, and inevitably, when I probe back what has triggered this, when did it start, they'll tell me it was after a period of stress. And that could have even been the birth of their child. That was a period of stress, you know, and change and lack of sleep and that sort of thing. That's when their conditions began.
And as humans, I guess, do we always have this fight or flight type mentality, whether we know it or not?
Actually, we do. It's always there to some degree, because we have to survive in this world, right? So it's our automated system of survival. And that automated system is also apt to have a fight or flight response if it's threatened in some way.
And that's stress, right? Those are the stress.
That is how that is kind of the automated sense of stress that's going on
I see.
in us, right? And some people it's more conscious, or some people are more conscious of it, and other people are completely unconscious. It is just running.
So when you find one of your patients, okay, you've diagnosed them, okay, for whatever reason, they are indeed stressed out. What's this specific treatment that is pretty simple? What would you recommend?
Well, the first thing is if they're coming just for that, I have to determine, is there actually a chemical imbalance going on in them, and some blood work or a urine analysis, some kind of testing might be necessary. Once we've ruled that out, then yeah, it's clearly lifestyle. We could put some things in place that will help.
And in your office, you actually, what do you have them do?
Well, I know a teacher, a friend, a brilliant human being. His name is Dion Vimal, and he came up with this technique, and I use it every day in my practice now. It's called Samadhi Sleep. So actually what it does is it takes you out of the fight or flight state, and it puts you in, we call it rest and digest mode, which is the opposite of sympathetic stimulation and increasing the parasympathetic stimulation.
Okay. And what is that quickly? What does it look like?
What does it look like?
Yeah.
Would you like to help us out in demonstrating
Yeah,
that?
why not? I can do it in this chair?
It's actually a physical position that you put your body in, right?
Okay.
Because we're talking to this unconscious fight or flight.
Do I just lean back, or?
Yeah, you would think it would be that easy, but actually we're talking to the reptile part of us. So we need to really take it into a state of basically allowance, which is when your feet are up. So I actually have to have you lay down on the floor and put your feet in the chair.
Okay.
Now
here's the microphone.
All you need is 20 minutes a day.
It's like, and put my
put
feet
your
up?
feet in the chair and,
nice white
and
chairs.
lay back. And you don't have to do anything now.
Just like this?
Yep. Just be. And you just allow.
And so for 30 minutes?
20 to 30 minutes a day.
My wife's not going to allow this.
Right.
No, but this is, okay, so this is it, huh?
That's it. It's called Samadhi Sleep. It really is amazing. I have reports back on it.
Dr. Wells, this already feels amazing. Thank you so much. I appreciate you being here. Folks, we'll see you next time.